So for Samantha, she was an out-of-town patient from Illinois, and she had breast augmentation already with a lift.
So yeah, I did actually have my first surgery in Chicago. That was July of 2009. I wasn't happy with the outcome. So I just kept looking and looking and looking at different doctors' work, and I saw Dr. Kim and I didn't find anything better.
And her problem was that one breast was significantly higher than the other with what appeared to be a capsular contracture from her photos. And then she also had some nipple size asymmetry, and one breast was kind of shifted off to the side compared to the other ones. The main objective for her surgery was that she wanted to go larger and then also gain a lot of symmetry with the breast and the areola size.
Well, another thing besides the revision and the lift is I'm going a little bit bigger. I want more of a fullness, natural look, and I know that Dr. Kim is known for giving a natural look. This is a big reason why I wanted to come to him. When I met him, I felt really comfortable. He seemed like a great guy, and he made me feel really comfortable. He asked me what my main concerns were, what I was looking for, what kind of look I was looking for, and made sure that everything he was going to do was what I wanted, which is really important. I'm not as nervous as I guess I should be. I think I was more nervous yesterday than today, and like the past few months about this. I am nervous, but I'm just trying to block it out. That's how I am, I think. I trust him. I think he's gonna do a great job.
So on surgery day, we took Samantha in, and starting with the right breast, just looked at the pocket, kind of adjusted the pocket position with internal sutures. The stitches are used to kind of close the pocket off laterally to help the implant sit more in the center. And then redid the lift so that the breast was more lifted and the areola was a little bit smaller than it was previously. She was going larger, so we didn't need to do as great a lift as if she wasn't going larger, because the larger implant helped fill out the looseness in the tissue, but she still needed a little bit more tightening, so we took off a little bit of the extra skin and then did a little bit more tightening. And then on the left breast, it was the same, except she had a little bit of capsular contraction on the left breast, so we went in and took the scar tissue out. That way the implant was able to drop down, give a more natural appearance, and then also had to cut a little bit of extra skin on the left side too. So we're just finishing up now with a breast revision case. We took out 500 cc silicones and replaced them with 700, and we redid her lift. It's going to take maybe a little while for the implants to settle in, but I think once they've completely healed, she's going to have a nice result. So Samantha came in today 6 days after surgery, after revision of her breast augmentation with lift, and so far she looks great.
I think my results are incredible. It's very soft, natural, full look, which is what I was looking for, and just they're even, they're fuller, beautiful, they look great.
The right breast initially was over off to the side, but now it's in the center, and the left breast is lower and a more even position. The areola look pretty much exactly the same size. Breasts have evened out significantly. I think the one areola might be slightly higher than the other, but overall it has great symmetry, and the size looks very similar. So far she has a great result. At 1 week she looks very good, very symmetric, but there's still a little bit of wrinkling from that lift around the areola. This will smooth out in about maybe 3 or 4 weeks. And the main thing for her is just to take good care of them so she doesn't redevelop that capsular contracture.
And I know it sounds silly because it's just a breast augmentation, but when you feel complete or when you feel satisfied with your body, it makes you feel more confident, more happy, just to enjoy life more. I'm a lot happier now, and definitely recommend Dr. Kim to an out-of-town patient.